Difficulties in cystoscopy. The dangers of cystoscopy have already been mentioned on page 54. The difficulties of cystoscopy are derived from sources of urethral obstruction, bladder irritability, the presence of pus or blood, and the presence of lesions so extensive as to disfigure the cystoscopic picture. Urethral obstructions. These are to be dealt with as for a passage of a sound or catheter. The meatus cut, stricture dilated or cut, the prostate surmounted by forcible depression of the ocular end of the cystoscope. The irritable bladder. The bladder may be irritable on account of nervousness of the patient, severe inflammation or actual contraction. Sympathetic management of the individual and thorough anesthesia will overcome these difficulties in large measure. The modern cystoscope permits a fairly complete examination with no more than 50 cc's of fluid in the bladder, though under such circumstances one may fail to catheterize the ureter. Pus or blood. The presence of much pus or blood in the bladder requires a relatively thorough, repeated preliminary irrigation with small quantities of fluid. If the bladder is sensitive and there are no clots in it, this irrigation should be carried out chiefly by means of the irrigation vents. These admit and expel the fluid much more gently and slowly than when the opening at the end of the sheath is employed. If blood clots are present, however, a few injections through the open sheath with the syringe, alternated with suction if the injected fluid does not return, must precede the more gentle manipulation. Even if the bleeding is free at the time of the examination, a fairly satisfactory exploration may still be made by patiently going over the bladder wall, bit by bit, while alternating the inflow and outflow through the vents, so that the examination is made practically through clear fluid that is being injected into the bladder before contamination with blood has time to occur. This method of examination is conducted with the bladder almost empty all the time. The use of water at room temperature probably diminishes the bladder and ureteral contraction, and this somewhat facilitates the examination. Pus in the urine itself is not nearly so grave an interference with cystoscopy as blood. For the pus, even though it is pure and flows quite freely from the ureter, never contaminates the bladder fluid so quickly as free bleeding does. Yet the bladder that contains much pus is likely to be a gravely inflamed bladder, and the object of the examination is likely to be catheterization of the ureters whose mouths are lost amid this inflammation. Under such circumstances, pyuria may prove an insurmountable difficulty.